one of the biggest obstacles when treating patients is pain. Pain management is everything, and you get a lot of different pain thresholds are varying. Some people, they can handle all the pokes, some other people, they can't handle any pain at all. So I was doing this lady's temples, and nothing seemed to work. I injected maybe like 10% of the syringe, and I couldn't get past it. I tried everything, and I ended up getting through the treatment, and we ended up meditating.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Joey Sesson, who is a board-certified nurse practitioner, entrepreneur, and the founder of Impeccable Aesthetics, one of Hawaii's most successful med spas. He's the only company-sponsored NP trainer in the state and a national trainer for Regenerative Aesthetics, specializing in advanced injectable techniques. Joey also holds an MBA in entrepreneurship and healthcare management, blending clinical expertise with sharp business acumen. Known for his innovative med spa model and focus on efficiency, he's passionate about empowering other providers, building wealth, and breaking industry norms. So Joey, welcome and good to have you here.
Good to be here.
Yeah, so let's dive right into it. How did you first get interested in aesthetics?
So it's kind of a long story. I actually was a hospital nurse for a while. The hospital I was working at the time went bankrupt. So with it going bankrupt, I found another hospital job, and I didn't want to put all my eggs in one basket. So I started doing all these PRN jobs, here and there. And I just so happened I was a recovery room nurse for a plastic surgery clinic. And that particular plastic surgery clinic just started in the med spa industry. So, they started to buy one machine. I learned how to use that machine and started to learn how to use all these different lasers. And lasers is kind of the gateway to aesthetics. And then I asked the practice manager at that time, I want to learn how to inject Botox. Started injecting Botox, and then, filler came right after. And after that, everything just boomed. I ended up leaving that practice, unfortunately, just because I felt like, when you get to a certain level in aesthetics, your time and the amount of energy you put in for every patient, I felt like I wasn't getting compensated like what I should have. So I ended up, I started off really, really small. I treated patients at their homes. I had a little tiny room in a permanent makeup space, and I guess one of the owner of that permanent makeup space, she kind of opened me up to being an entrepreneur and opening up my own business.
Interesting. So yeah, it's actually your background is very interesting because you have the MBA in entrepreneurship. So it's not, I don't get a lot of people who have that strong business background. So could you talk a little bit about, like, in your introduction, you talked about like the different business models of aesthetics, kind of like how you've put together this unique blend, and really like how you're able to cut out the middleman, how you're maximizing profits, ensuring patient satisfaction, so on and so forth. Like, could you talk a little bit more about that? Because when I bring guests on here, they talk a little bit more about, like, they're more from the medical background. They don't really have the business background, but they just kind of learned how to become a business owner.
Yes.
You kind of have that training in it. So can you talk a little bit more about that?
So, traditionally the way med spas are run, or like from 20 years and up until now, especially in Hawaii, usually there's owner is the capital investment person. Capital investment person finds practitioners to work for them. They pay practitioners based on skill, but compensation wise, it's not as much as if you went on your own. And the problem with that business model is, you have an owner who has no vested interest into the patient. They don't even know what's going on. So, my business model is practitioner owned, practitioner invested. The way that promotes patient satisfaction is, if I don't have happy patients, nobody's going to come back. With that being said, the way that I save patients money is, they come to me, they get their treatment. There's no middleman. I don't have to pay anybody because I'm the one delivering the care. Granted that's the way that I started my model. Now, that I've expanded, now I just recently moved into a new med spa. I just built it out. This is one of the rooms that you see behind me. Now I have several practitioners working for me. Compensation wise with the practitioners that work for me is a little bit different from a traditional med spa, where my practitioners, they're compensated in a way that they get a lot more. you know, versus an hourly, you know, with that being said, it's like, so they get paid in a commission-based way. You know, I know it's illegal. So, you know, we have it set up so they get compensated, and with them being compensated, you know, they never leave. I mean, I have no problem with my practitioners working for other practices. You know, I know a lot of practices, they put up non-competes, or they make their employees sign non-competes, but, you know, I have no problem. And everyone that works at my practice, everybody's 1099. You know, I feel that 1099 practitioners, they want to deliver great results just because they are their own business. You know, a lot of times people, they don't want 1099 practitioners because they feel like their business will get compensated less. You know, they don't have that employee that is working for a measly hourly wage. You know, and it's just, they're always afraid that their injector, or whether it be an injector, esthetician, they're going to leave. For me, you know, compensation is a big reason why I left at the med spa that I worked at. You know, I would bring in all these patients, make X amount of revenue, and they would pay me like 1%, and, you know, some measly hourly wage. Now, the way that in my business model, it's a little bit different, where my practitioners, they are experienced, but they'll never leave. I mean, you know, with the way that I compensate them, they'll never leave.
Do you think that this model that you have built out for your business is something that can catch on for a lot of other med spas across the country, not just Hawaii? Or do you think that what you have is very unique in a sense that maybe a lot of other med spas wouldn't want to do it because maybe it cuts into their profit margins? Maybe they just want to maximize profit. Like, what are your thoughts on that?
So I do think that, I do see some med spas on the continent that has implemented this business model. You know, Hawaii is a little behind with everything. You know, it takes a long time for Hawaii to catch up. You know, and I don't know if it's just because of the predominant Asian culture here. You know, everybody's really, really passive. They want to see what everybody else is going to do before they jump on it. You know, with being assertive, being, you know, the forefront of everything, you're going to capitalize on everything. I do think that it's a practitioner-owned med spa. This is a business model that would work for them. But if it's you know, capital investor owner, it's not going to work for them because they're not practitioners. You know, all they want. I feel like owners that own med spas, you know, it's all about the money for them. You know, it's all about the money. They have no vested interest in their patients. They don't know what's going on. And it's just a really, really different business model. And I think that, you know, I started from a little room and it's been very successful. So
it sounds like the secret to the success here is being the practitioner, also being the owner, also being the one to put the money in to start up the business, because you're then invested in all fronts of it.
Exactly. Okay. In all fronts. And you know, it does, the bottom line is, you know, everything's about patient satisfaction. You know, there's so many in Hawaii or in Honolulu, there is so much competition. This is like Newport Beach, like New York City. I mean, in the building that I'm in right now, there's like 5 different med spas in here. Everyone's trying to get that competitive advantage. You know, there are several med spas here that are still owner owned and not practitioner invested. And, you know, I feel like that's a dying model. That slowly but surely, you know, the injectors that work there, because they're not compensated appropriately, they'll end up leaving. And, you know, you then the practice itself will run through a lot of different injectors, you know, a lot of different estheticians. You know, the injector kind of makes the practice. I strongly believe that. You know, you have a good injector, that injector will bring tons of people, and that's how you kind of flow those people to other practitioners that work there.
Got it. Now, I want to dive a little bit deeper into the actual practice itself. What are some of the most common treatments that your patients, your clients come to you for? And also, why do you think they're so popular?
You know, for me personally, everything is injectables. You know, now filler, because of that Dr. MRI scan, filler's not as popular. Everything is all about natural rejuvenation now, collagen stimulation. You know, I have an alt therapy machine here which also provides collagen stimulation and Botox. Everybody wants to look younger. Everybody wants to prevent age from happening. And as far as what I do in my practice, I primarily do all the injectables. You know, I have other practitioners that do facials, they do peels, they do lasers. I just do injectables.
Now, I heard you mention people are looking for more of that natural look, and that's what I'm hearing from a lot of other practitioners that I bring on as guests. Do you feel that that's something that's been coming up kind of as a newer trend? Or do you think it's just maybe like a passing fad? Like, what are your thoughts on just the whole people wanting to look more natural and not have that overdone or done up look?
I think it's not a passing fad. I think it's a trend that will be present for a while. And everything is fueled by social media. One person sees this on social media, another person sees that on social media, and nobody wants that overfilled look already. Unless you live in the boonies where you don't watch social media. Everybody wants to be natural. They want to be rejuvenated. They want to be natural, and I think it's here to stay for a while until a new trend comes up or arises.
Now, with that in mind, the more natural look, are there any new or emerging treatments that you're seeing out there that you're particularly excited about?
So actually, I just got this new treatment, and it's stem cell harvesting. So it's by a company called Acorn. So I'm one of 7 practices that have it in the whole entire nation. So what stem cell harvesting does is it actually protects your future self. The way that we harvest your hair or harvest your stem cells is by pulling your hair follicles. So in the back of your head, we pull about 50 hair follicles. With those hair follicles, we send it to a lab. The lab analyzes the quality of stem cells. And with the stem cells, they send it to cryo, and they leave it in cryo until you need it in the future. So some people, they don't understand why people would do that. If you had a history of cancer, you have a history of an autoimmune disease, that's before you develop the autoimmune disease, before you develop cancer, you would want your healthy stem cells to be there. So with emerging technology, the FDA kind of bars a lot from happening here, but nationally, with stem cells, people are doing some crazy things. We're growing muscle fibers, growing organs, which is something that will come here eventually. So, going back to the whole Acorn thing, they have this new thing is, conventionally you could only get stem cells from your muscle or drilling into your bone. This is a non-invasive, non-painful way to access your stem cells. It's similar to cord banking, like when you're a kid. So if an individual or if their parents wasn't financially savvy or didn't have the finances at the time they were born, this is a kind of a supplement for it. And secondly, with those stem cells that are sent to cryo, you can make something called secretomes from it. So secretomes are, I don't know if you've heard of salmon sperm DNA or PDRN. It's a big trend right now. So secretomes are autologous PDRN, autologous exosomes, autologous PRP, where your hair follicles can produce all of these natural autologous, meaning from you versus from a fish versus from another random person. So I think that's an emerging treatment that will really, really be big probably at the end of the year.
Now, regenerative medicine is kind of a medicine, or I guess a treatment that's been out there for a little while, but it seems like it's largely flown under the radar. It seems now, though, there's been a little bit more of a push for people in the med spa space to bring it on. But I think a lot of consumers really have no idea what it is. They've heard, stem cell this, regenerative medicine that, PRP, PRF, all those ones. For people that maybe are a little bit skeptical or maybe have a little bit of fear of what goes into it, what would you say to those people that think, this is brand new, the FDA has banned it, so it must be bad for a reason, they must be banning it for a reason? Like, what would you say to those people to make them feel a little bit more at ease that this is a reliable treatment, there's a lot of potential in it?
So probably the biggest thing is the secretomes is from yourself. A lot of times, I know a lot of people have been doing Rejuveron or salmon sperm DNA, and you don't know where they got that DNA. I mean, it's from a fish. What is a cellular message telling your body? So I've never gotten Rejuveron, I've never gotten PDRN, but with the secretome, I harvested my own stem cells, and it's going to be sent to me soon, and I have no hestation of injecting or using something topically or microneedling something topically that comes from there. That is probably the biggest thing is the autologous, the bio messaging or the cellular messaging that you send to yourself is better than anybody else.
Okay, thank you for sharing that, Joey. Now, I want to talk a little bit more about the practice itself. I want to understand a little bit more about how you differentiate your practice from others in the industry. And you kind of touched on this a little bit, but if you can dive a little bit deeper, because you mentioned that where you are, there's a lot of competition, and you talked about like you being the practitioner plus the owner plus putting the funds into it to build it from the ground up. That's what separates you. But is there anything else that you can talk about that really sets you apart from the others?
I guess developing client rapport, being invested in your clients, actually listening to your clients, not trying to sell your clients treatment after treatment just to make money. I know money is the bottom line, but developing that rapport, really being part of their treatment plan and ensuring that they're satisfied.
And within that vein, how much of that do you feel that there's an educational approach to that, like building the rapport, but also providing the education? Because I'm sure you get a lot of clients, a lot of patients that come in, they have lots of questions, or they think that, oh, I want this, but they need something else. So could you talk a little more about how you approach educating your clients, and kind of also how that ties into building that rapport?
You bring up a great point. Education is key. I mean, initially when people book a consult, they want to get a treatment. The pre-op or the pre-procedure education is very, very important. Answering all the questions, making sure that you turn every stone, every possibility. Giving them options, multiple options, and not pressuring clients into thinking that they have to do it now. Just giving them options. Giving them time, saying you can contact me. I think that instead of thinking of clients as, your customers, you have to think of them as your friends as well. You just have to really, really understand what they're coming from, never trying to oversell, always trying to, look out for what their best interest is.
Okay. Now, I'm sure that you've gotten a lot of misconceptions about the treatments you provide. Would you mind sharing a couple common misconceptions that you hear most often?
The biggest one is filler is going to make me look fake. So there's multiple ways to inject filler, and I think that filler can be done naturally. Filler can be done it can reverse time, but there's so many like I said, there's so many practitioners out there, and with all the practitioners, there's so many practices that they take a weekend course and they think they're the best, or they promote that they are the skilled practitioner really when they only have like a couple hours under their belt. And those type of practices, those type of practitioners should be working under a doctor or a med spa so they can get guidance. Then you have these patients that look crazy, and they come to you as like, oh, we have to dissolve everything. What do you mean we have to dissolve everything? I just spent thousands of dollars on it. If you want me to touch your face, we have to dissolve it so we can do it right.
Now, how often would you say that you get people coming in that they think they want something, but in reality, they really need something else, or they come in with just completely wrong knowledge or education about the treatments? How often do you think that happens?
I would probably say about 70% of the time.
Wow, that's really high.
70% of the time, and a lot of these clients or individuals, they get everything from social media, from TikTok or from Reels, and it's like, I want this. When you educate them, it's like, you really, to get that, you need to do this, X, Y, and Z. And most of the people that are patients that come to me, they're very receptive. I'm like, you have to do this, you have to do this, you have to do that. Versus we'll just put a syringe of filler in your face, which is not going to do anything.
Do you feel like that social media is a net benefit or a net deficit, as far as like lots of people see what's going on online, like, oh, I want that, let me go to my local med spa. So like, there's a little bit of that marketing aspect that goes into it, where it's like social media, it's so easy to share this so people see it and they want it. But also on the flip side of that, it's unrealistic expectations. Oh, I want this. Well, they used a filter. They used 10 different filters to look like this. So
I think so. For the marketing purposes, I think it's a benefit where, it promotes awareness and everything, but there is the net deficit with, realism, or treatments being realistic. And then what even makes it worse is if somebody shares how much they paid. How come this person paid that when you're charging this? It's such a wide array of information that some information is good and most information is not.
Okay, so when people are looking at all these videos or images online, would you say that there's a very high percentage that it's not real?
Yeah, it's not real. So when you look at, like, it drives me up the wall when you see befores and afters. The before picture is a shadow picture, and the after picture is bright light. And they try to look at this rejuvenation. It's like, you're gonna look more wrinkly in shadow pictures, and you put this big bright white light, it's shining on your face to make it look like it's a good after, and that just drives me crazy.
Now, when someone does come in for a treatment and you've determined, okay, this is what you're looking for, this is realistic, this is what could be be done. How do you balance between providing that relaxing experience for them, but also making sure that their safety and their well-being is also taken into account? So I'm sure you get some people who's maybe a little bit nervous, maybe it's one of their first times and they're just a little bit anxious about how it's going to go.
So now it's a little better, at all my practices. So, I work at this practice. I have another location in IAEA, and I have another location on the windward side. I always work with assistants now. So my assistants are very, very good at making, my patients comfortable. Prior to having assistants, I would always talk to them first, make sure everything's comfortable, put numbing medicine on, use any type of devices just to kind of ease the anxiety.
Okay. And after that, I'm curious, when you look at medicine, people think that, okay, there's a process in place, there's a protocol, there's a step-by-step that you really have to follow in every single situation. But what role do you believe that creativity plays in how you approach your patient care?
I think creativity is immensely important in aesthetics. Nothing is A to B here. Nothing is concrete. Every face is different. And, just understanding like the product you're injecting or, whatever you're doing on the patient and how it can create or the effect that it has on a patient is very important. And, just understanding what the patient would think is beautiful or what the patient would think is masculine. And, really, really asking all those questions before you start putting anything in their face.
Because I brought people on before where they almost consider themselves more as of an artist than a medical practitioner. And I always thought that was very interesting.
That is actually very, very true, where you have to have that artistic background, and you have to understand like what is in or what is beautiful now or at the present time. I do see myself as an artist. I do see myself as a face artist. I mean, I can't draw, but I can make somebody look younger or beautiful.
So when it comes to aesthetic medicine, I guess in your particular situation, how much do you think is, I guess, what percentage, if you had to put a number to it, what percentage is art and what percentage is science?
I would probably say 70% art, 30% science.
Okay. I think that's a very interesting number. I think that would shock a lot of people. I think when most people think about medicine, even aesthetic medicine, like, oh, if anything, maybe 80% science, 90% science, and a little bit of artistic. But it's interesting that you flip that, where you put a lot more emphasis on the artistic side of it.
Yes, it is like a very important consideration, even before getting into aesthetic medicine. A lot of people want to get into aesthetic medicine because they see the money. That's the bottom line. So, you can make X amount of money. My work environment is not working in the hospital, not working with all these demanding patients, which is all fine and dandy. But when you really, really get into it and you inject that first syringe, or, you get a couple hours in, people then realize it's like, oh my God, it's not as easy as that course I was in where I inject A, B, and C. And why does it look messed up?
Do you believe that a practitioner that is top class from a medical perspective, like knows exactly how to do every single procedure, treatment by the book perfectly, can be successful in the aesthetic field? Or do you believe that you have to have some level of artistic ability to be successful in the field?
I think you have to have some level of artistic ability, but going back to your original question, I think if that top grade medical practitioner, if they're open to and receptive to learning, then it's possible. It's like, a lot of times people are not open and receptive to learning, especially if they're at the top of their class and I know how to do everything.
Yeah. Okay. Now, Joey, I'm sure that throughout your career, you've probably run into some very challenging cases. So would you mind sharing a story, maybe just one case where it was a really, really tough case that you were presented with and how you were able to get them a successful outcome in the end?
Well, this might sound like I'm cheating, but I just had a really, really tough case recently within the last month or so. I mean, tough meaning that, one of the biggest obstacles when treating patients is pain. Pain management is everything, and, you get a lot of different pain thresholds or varying pain scales with, some people, they can handle all the pokes. Some other people, they can't handle any pain at all. So I was doing this lady's temples and I tried everything. I numbed her, I did injectable numbing, and nothing seemed to work. I injected maybe like 10% of the syringe and I couldn't get past it. It just was squirmy, sweating, hyperventilating and everything. With therapeutic talk, I tried everything. And I actually I ended up getting through the treatment, and we ended up meditating. Yeah, meditation really worked for her. So,
interesting. I guess you have to be really creative in some.
Yes. Yeah, meditation and a lot of squeeze balls, and she ended up getting through it. Yeah, and she was really happy.
Interesting. So I guess that just reflects on like medicine, like again, going back to medicine, like people think that there's a process, the procedure. Hey, sometimes things don't work. So what are you going to do? I guess you have to really be able to think on your feet in situations like this.
Yes. And you know, it happens more often than people would imagine. Right? You know, it's like not only with pain or people, you know, I've had multiple people faint on me because they hold their breath. They hold their breath, they vasovag, and they faint, and you know they wake up. What happened? And it's like, oh, you fainted, and you know it's something that we would see a lot in the hospital. So you know, it's just not a new thing.
Yeah. Well, I guess we can't just hand out alcohol to get them to relax, can we?
Yes. I wish I could. Yeah. I do have a Pronox machine here, though. That helps a lot. So.
Last resort, right?
Yes, very much so.
Okay. Well, Joey, where do you think the future of aesthetics is going? We talked a little bit about like people wanting that natural look. We talked a little bit about regenerative medicine, but I mean, where do you think the future of aesthetics is going?
I think it is going with regenerative medicine. Regenerative medicine, hormone therapy, peptides, and natural collagen or natural treatments. You know, and I do think that is probably the next 5 to 10 years where hormone therapy, regenerative medicine, and collagen stimulation will kind of take over. And you know, Botox.
Okay. What do you think it's going to take for, I guess, the FDA to loosen up regulation, particularly around the regenerative medicine side? Because they've been really anti-regenerative medicine. But I don't know if it's just a matter of more and more science coming out about it, where they're going to eventually cave and start opening up a little, and then eventually just open up the spigot, or if something drastic has to happen, or maybe they won't do it for decades. Like, what are your thoughts on what it's going to take for really the government to open up regulation around it?
I think as the international community gets more studies in, you know, regarding regenerative medicine, stem cell growing, and you know how to harvest muscle tissue. I think as that happens, you know, the FDA hopefully will, you know, read those studies, you know, and as soon as there's multiple studies, you know, maybe they'll open it up a little more. Or I think, you know, something drastic has to happen where, you know, this mass sickness happens and they need to really make organs or something.
I see. Okay. Well, Joey, I have one last question for you, but before I ask it, I want to point people to your website at www.impeccableaesthetics.net. Now, last question is, what is the most important piece of advice you can give to somebody who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
I would say go to multiple practices, read reviews, go to multiple practice, interview multiple injectors, practitioners, and go with your gut and feel with the one that you feel most comfortable with. Don't just go to one person.
Okay. Well, there you have it. Joey sharing his expertise. So Joey, where can people contact you in your practice?
You can contact me on Instagram at impeccable_aesthetics, or give us a ring at 808-272-8555.
Okay. Well, Joey, thanks for being on the show and sharing your message.
Thank you, Danny.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.